Welcome, everyone. My name is Corinne, and I will be your moderator this evening. I'm excited to welcome Dr. Joy Void-Holmes as our speaker tonight. Before we get started, I would like to take a moment to go over some housekeeping. This webinar is sponsored by Dentsply Sirona, and Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand. Dr. Joy, welcome, and thank you for being with us tonight. I will pass it on over to you.
Good afternoon, good evening. My name is Dr. Joy Void-Holmes, and I will be your presenter today. Today, we're going to talk about biofilm. And the title of this presentation is When Biofilm Strikes, How, Why, and What to Do. So before we get started, I always like to put some disclaimers and disclosures out there. So with respect to any continuing education course that you take, please know that you should always apply your own professional judgment with respect to any and all of the information provided. Henry Schein Dental Academy cannot support or refute any product claims that are represented in this presentation. I'll also want to note that I am a key opinion leader for Dentsply Sirona. I do want to thank Dentsply Sirona for support of this program and for the honorarium provided by Henry Schein Dental. So just a little bit about myself. Again, I'm Dr. Joy Void-Holmes. I received my initial training at Howard University, went on to receive my advanced degrees from Nova Southeastern University, both my master's and doctorate of health science. I currently am owner of my own company, Dr. Joy RDH, and co-founder of Gel Ed. I sit on the editorial review board for Inside Dental Hygiene, and I am on the clinical advisory board for Vital. I do hold several other positions. Most notably, I am a member of the Maryland State Board of Dental Examiners and member for the CDCA, REB, and now CETA dental competency exams. I am also an active member of the American Academy of Dental Hygiene, the Maryland Dental Action Coalition, and the American Dental Hygienists Association. So let's get started. What I'm going to do now is to turn my camera off. And at the conclusion of the program, I will turn my camera back on. And this will just ensure that we don't have any issues with connectivity. So if you could bear with me for 1 second. Technology is only good when it works, right? Oh, excuse me about that. Well, I guess we're going to continue with the camera on. Okay, so what are our discussion points for this evening? Well, first, we're going to discuss the etiology of oral disease. And specifically, I'm going to talk about periodontal and caries disease. Next, I'm going to talk about the benefits of using a staged approach for deposit removal. We're also going to discuss protocols that assist with the removal of calculus, biofilm, and stain. We're going to talk about tools that have a proven efficacy, such as the use of ultrasonics, air polishing, and specific polishing paste. So that's something that I don't think that we give enough attention to. I'm going to talk about the advantages of using appropriate ultrasonic tips at the appropriate power settings. Also, I'm going to include just a small review on proper techniques and maintenance, which helps to increase scaling efficiency. And then last, we're going to discuss ethical polishing practices. So, in healthy individuals, the host and the microbial communities generally live in a homeostatic balance. And so what we find is that there's something that causes the equilibrium within the oral cavity to be disrupted. And typically that's caused by poor oral hygiene. Sometimes there's inflammatory and autoimmune diseases that we have to deal with. There's immunodeficiencies, and it also could be a diet which could be rich in molecular carbohydrates and other health issues that we have to tend with. So what happens when this equilibrium is disturbed? Well, we get what's called dysbiosis. And so ultimately, what happens is that you get those pathogenic microbes. They tend to take over things. And so this is what happens. You get the onset of inflammation. Excuse me, a little bit of tongue tie there. You get the onset of inflammation, and that's what causes some of these oral diseases. And so in our mouth at any given time, there are over 1,000 different microbial bacterial species, and it numbers around 20 billion. Okay, just in the oral cavity alone, and they vary. What we know is that these microbes together, they form what we call biofilms or plaque biofilms, and they differ in composition based on the specific surface that they're located on in the mouth, the person's overall oral health status, and then different environmental conditions. And those conditions would be the composition of the gingival trabecular fluid or the different carbohydrate intake. So there was an interesting article that I read. The title of it was The Integrated Hypothesis of Dental Caries and Periodontal Diseases. And there were a few takeaways from this article. This article could be found in the Journal of Oral Microbiology. And I've highlighted two of the key points that I want to bring your attention to. The first, it says that the excessive intake of fermentable carbohydrates may contribute to inflammation in periodontal diseases resulting from hypoglycemia. Second, an integrated hypothesis emphasizes that both dental caries and periodontal diseases originate in the dynamic stability stage and emerge in response to a nutritional imbalance in the microbiota. So, what does all of that mean? Well, let's take a look at the ecological hypothesis. What is that? It states that it's changes in the environment that can predispose a site to disease because of modifications in the composition of the resident microflora, more specifically, the metabolic activity of that microflora. So basically, there's a shift, right? There's something going on in the environment that causes a shift with that resident microbiota. Dynamic stability stage, what is that? So this is where an equilibrium where teeth, gingiva, and the oral mucosal surfaces remain clinically sound in spite of the presence of dental plaque. The dynamic stability stage is a function-focused term of symbiosis, okay? And so symbiosis is a status that is provided by the dynamic stability stage. So what happens? What happens when environmental pressures are introduced and we get a breakdown of resilience, right? So everything was fine. Everything was living in harmony. There was a symbiotic relationship, but then something happens. There's a breakdown in resilience. Typically what happens is that there's a shift that involves the pH, okay? And it pushes the oral cavity to either a more acidic or a more alkaline environment. And so pathogens that are responsible for both caries disease and periodontal disease can thrive under these conditions. Let's talk about selection pressure. And you're probably thinking, well, how does all of this fit together? Well, selection pressure, this is the extent to which organisms possessing a particular characteristic are either eliminated or favored by environmental demands. In the oral cavity, it is selection pressure that controls whether your biofilm is normal or malfunctioning. The selection pressure that we are referring to here is the actual pH. So in the mouth, pH operates as that selection pressure. So you heard me mention the term biofilm a few times. So what is biofilm? Biofilm is a complex communal three-dimensional arrangement of bacteria. That's a mouthful. So based on this definition, what is the big deal about biofilm? Why do we need to be so concerned about it? And why does it give us such a run for our money and wreak havoc, not only in the mouth, but in the body as well? Well, it's because of the sophisticated structure of biofilm. And as you can see on this next picture here, you can see that these biofilms have a unique architectural structure. They are not, the biofilm or the bacteria specifically are not uniformly distributed throughout the biofilm. Instead, they present as aggregates of microcolonies, and these microcolonies vary in shape and size. You're also going to note, according to this picture, that there are different channels between the colonies, and this allows for the circulation of nutrients and byproducts, and it helps to provide a system to eliminate waste. What you can see here is many different colors, different types of bacteria, different shapes of bacteria. Okay. What's so sophisticated about biofilm is that they are actually able to communicate with each other, and they do this through a process called quorum sensing. And this is what this does is that it enables the bacteria to monitor each other's presence and to modulate their gene expression in response to the number of bacteria in any given area of the biofilm. Okay, so essentially, what this quorum sensing does is that it coordinates disease progression. So there is actually a life cycle of a biofilm. It's a little bit quicker than what we are accustomed to in terms of the life cycle of a human. So the life cycle of a biofilm and involves attachment, and so this is where the surface of the bacteria, if they're not floating freely, they actually attach somewhere, and this allows them to colonize. You then get colonization and then permanent attachment. From there, you get the microbial growth, reproduction, and coadhesion. You get maturation, and then you get detachment. So these bacteria are very, very sophisticated. What we want to do as oral health care professionals is get to this bacteria before it actually attaches. So, a little bit more about biofilm. There was an article entitled The Role of Dental Plaque Biofilm in Oral Health by Joanne Gorillian. She discussed the research related to dental plaque and stated that based on this research, we now know that dental plaque has been recognized as biofilm. Believe it or not, people still have a problem with the term biofilm. So this slide pretty much sums up some of her research with regards to this. And again, a lot of this is what I've already said in previous slides. What's really important is that we know that this biofilm, it has this slimy extracellular matrix. It's this matrix that makes it really difficult for us to remove biofilm sometimes. This matrix helps to protect bacteria deep within the biofilm from antibiotics, antiseptics, and it actually increases the colony's likelihood of survival. So, mechanical methods like toothbrushing, interdental cleaning, professional scaling procedures, they are going to be required regularly and effectively, used effectively to disrupt and remove the plaque biofilm. That's going to be really, really important. So, with the identification as biofilm, with it being the main etiology in the development of periodontal diseases and caries disease, and the now well accepted data linking oral and systemic inflammation, this dictates that clinicians should often reconsider their the goal of periodontal therapy. They also need to reconsider the endpoint of periodontal procedures that they partake in, and they also need to reconsider selected treatment options. So, this is where I often ask the audience to kind of evolve their thinking, transform their approach to treating periodontal disease, specifically if you are still looking at calculus as the main culprit for the development of periodontal diseases. Our focus really needs to be on biofilm. And with the focus being on biofilm, we really need to concentrate on technologies that are going to be more effective in disrupting it and removing it. Dental caries and periodontal diseases are multifactorial diseases. These diseases are multifactorial diseases. And notice I said caries disease because caries is a disease, okay? Microbial deposits on the teeth is the only necessary causal factor for the development of these diseases. Whereas your environmental factors such as diet, smoking, and fluoride exposure, your host factors such as host immune and inflammatory responses, and your systemic factors like diabetes and other chronic inflammatory conditions are modulatory factors in this process. Okay. So it is the interplay between these and numerous other risk factors that actually predict the outcome of diseases, namely caries and periodontal disease. So before you treat biofilm, you need to be able to assess it. Now, I was one of the people for a very long time. I've been practicing since 1997, so I've just aged myself. But I only ever really used disclosing solution in dental hygiene school, and that was right before my instructor came over to check to see how well I polished. But this is the benefit of going to continuing education classes and continuing to educate myself. What I have found is that disclosing solution can be extremely helpful. How are you assessing your biofilm? So, if you think about our training, fundamentally, we are taught to remove deposits from teeth, whether it be calculus, whether it be biofilm or stain. And we want as much of it gone as realistically possible. Okay. What happens though is that we're going to be more likely to remove the things that we can see. and the things that we can't see often goes overlooked. So this is one of the reasons why it's really important to disclose. If you're able to see the biofilm, then you're able to remove it. In addition, we know that disclosing the biofilm can be an excellent patient education tool. So at the end of the day, disclosing solution focuses our attention, and it focuses our attention on the root cause of disease, which is the biofilm. So there are many different ways to control the biofilm. One thing that we can't forget is that at home care, we really need to be spending a sufficient amount of time educating our patients. So once the patients leave our chair, if they're not doing what they need to do at home, then everything you have done in the chair really is for naught. Okay. So biofilm control at home is going to be extremely important. Using a manual toothbrush and using traditional dental floss, those have been effective. But what research is telling us now is that there are additional tools that we can use to be more effective in removing biofilm. Funny story, I shared my room at RDH Under One Roof this past month, couple of weeks ago, and I typically only travel with a manual toothbrush. And my roommate happened to tell me, hey, I don't really think you care about your oral health if you're still using a manual toothbrush. And we had a good laugh about it. But her point was, you as a dental hygienist should know that using a power brush is certainly or can be more effective. What research is telling us is that it can be 30% more effective in biofilm removal. There is a lot of research surrounding the use of water flossers. The brand that I know, that I love, that I use most often is the Waterpik brand. That brand has been backed by over 80 published studies. Believe it or not, I have read each and every one of them. But water flossing technology can be really, really helpful. So whether you like Waterpik or you like another brand, for yourself and certainly for your patients, this can be a really effective tool. What we know is that most people don't like to floss. And if people are flossing, they're not being as effective. And they're especially not as effective in some of those deeper pockets. And this is definitely where the water flossing technology can be really beneficial. What are some tools that we can use in office to help with the bacteria and biofilm removal, lasers, right? So changing the structure of your patient appointment by immediately sometimes addressing disinfection. This will enable the dental health care practitioner to adopt a different approach to treating their patients. Especially, again, we need to really be focused on biofilm. What do we know about lasers? It definitely helps to reduce the bacteria in the pocket. It can remove the biofilm within the necrotic tissue of the pocket wall. And it can also be really instrumental in helping to treat periimplantitis and perimucositis. So definitely lasers is something to be considered. Air polishing. There's lots of research going on right now with the benefits of air polishing. Many of us who went to school back when I graduated, the focus was on supragingival air polishing, but we know that there are substantial benefits now to subgingival air polishing. What do we know about supragingival air polishing, specifically with glycine powder? It can be as effective as curates or ultrasonic instruments in removing biofilm subgingivally, 3 to 4 millimeters in depth of the pocket. We know that a full mouth air polishing can be really helpful in reducing P. gingivitis and other periodontal pathogens. Again, we really want to focus on the biofilm. What do we know about subgingival air polishing with glycine powder? Okay, in probing depths of 5 millimeters or more. When you're using an air polisher device with a subgingival nozzle, it can be more effective in that subgingival area. And what some research is showing is that it can actually be more effective than manual or ultrasonic instruments. So there are some practices who have actually switched to air polishing. Some people don't use traditional polishing devices anymore. Why do we still need to know about traditional polishing methods as well as air polishing? Well, we know that air polishing can be contraindicated for some of our patients, the same way ultrasonics can be contraindicated for some of our patients. So I always say that you need to be able to do it all effectively. You shouldn't know how to use an ultrasonic better than you know how to use an air polisher or better than you know how to use your hand instruments. There's no one size fit all approach for our patients. And so we have to be able to serve our patients to the best of our ability, given what they present with and what they need from us. With that being said, I do want to transition to coronal polishing. This is what most of us were trained on. This is what most of us are still doing. And we definitely need to make sure that we are utilizing the correct tools. We need to make sure that we are also using the proper medicaments when we're doing it. So, one thing that we were taught in school is how to selectively polish, right? And I think a lot of the initial teachings in hygiene school kind of fall by the wayside, but selective polishing is still something that we should be practicing. And so, what do I mean by that? It means that we need to select the best polishing agent according to the individual patient's needs. Okay. So, what are things that we need to consider when we talk about selective polishing? This is a nice pictorial here. This was actually created by Katrina Sanders. She did a wonderful job, and I do have permission to use it. I just think she did an awesome job putting this together. And so, if it's not broke, don't fix it, right? So, what are some of the things that we should consider? Number one, you need to consider your patient's conditions. Okay. So, do they have exposed cementum? Are they suffering from dental hypersensitivity? Do they have other dental conditions that we need to be concerned of? You need to be sure that you are selecting the correct agent. So, your polishing agent should be the least abrasive necessary to remove stains. When I first started practicing, and I temped a lot, and I can tell you that I went in many offices, and the only thing they had was coarse polishing paste. Okay, we have to get away from that. Coarse polishing paste is not indicated for all of our patients. And if you are someone, and again, I've been guilty of it, but if you are someone who only uses coarse polishing paste, then you are practicing unethical polishing practices. You need to consider air polishing. Are you using sodium bicarbonate? Maybe you have a patient where it's contraindicated, so you need to use a substitute like aluminum trihydroxide. You want to avoid, once again, those unethical polishing practices. Again, using one polishing paste for all polishing procedures. And then you need to use polishing grits in a progression of coarse, medium, and fine. So within the hygiene appointment, we have such a limited time to do what we need to do. So the last thing that we're thinking about is, oh gosh, I have to use these polishing pastes in order of progression. But there's a reason why you do that. If you're just using strictly coarse polishing paste, then you're leaving the tooth surface compromised, and that's not something that you want to do. So when you start to change the grits, you also need to make sure that you are changing the rubber cup. This means that if you started with coarse and you decide that you want to switch to medium or fine, you cannot use that same rubber cup. You actually need to switch it out. You may remember this from your initial training, the most hardness value. So these are we know that the structures in our mouth, they have a different hardness value, and we need to be aware of that. So this is really important. When you start to select different polishing grits, you need to be aware of their values as well, to make sure that you're not using anything that's going to compromise the tooth structure. You will note that cementum and dentin, they have a lower hardness value. So if you're using, let's just say, something like pumice on cementum or dentin, please know that you are causing some damage. Just like it is important to use the best polishing paste. You also need to consider using the best angle with that coronal polishing device. There are different types of prophy angles that you can use. Many of you are familiar with the rubber cup. Okay, so your rubber cup, it can come firm, it can come not as firm. Sometimes the angles of the prophy cup are bent a little bit. Sometimes you can get tapered prophy heads. There are also prophy heads that are smaller, and this is ideal for the pedo patient. I always recommend that any person who is performing coronal polishing procedures, they need to have a either soft or firm polishing cup, and then they also need to have a tapered brush. What is that tapered brush ideal for? It is ideal for removal of the pit and fissure stains or any type of food debris that may be trapped in those areas. These are also great around orthodontic appliances. And I'll also find these tapered brushes to be excellent on lingual surfaces, but you have to be mindful of your technique and your pressure, because if you are not careful, you could certainly rip that tissue to shreds. So we always have to be careful about that. Dense ply does have, I think I've used this new propy paste since I've graduated hygiene school, actually. It's just a lot of things that I love about it. Number one, it rinses away easily and completely. Um, that's one thing I love about it. There's nothing worse than using a polishing agent where you're using it in the patient's mouth and you're trying to rinse the patient's mouth out, and the prophy paste just seems to want to stick around and hang out with you all day. Okay. Depending on the grit, I know that it to be excellent, excellent, excellent for stain removal. So it can be really, really effective. It does have a unique proprietary formulation. So what this does, you probably wonder, well, why does she like it so much? It doesn't splatter. That is huge for me. I have to be able to use something that does not splatter. They also have options when you have color coded grit options. So it helps you to easily identify whether you're using something that's coarse, whether you're using something that's medium or fine. And then what's really, really important is that these pastes are gluten free. So these are safe for patients with gluten sensitivities. Patients are becoming smarter. They are definitely more concerned with what you're putting into their mouths and their bodies. And so, believe it or not, you're going to have patients that are asking you these things. Earlier, we talked about indications for grit. So we have, of course, you have your coarse. It used to be called extra coarse. Now it's plus. You have your medium and your fine. What would you want to use a plus or extra coarse grit for? So someone who has that heavy stain buildup that is just difficult to remove with conventional prophy paste. So to me, that patient is the patient who drinks a particular brand of coffee. I don't know if I can say it, so I won't, but it's one on every corner in your neighborhood, right? So they drink that particular brand of coffee. They are a heavy red wine drinker and they smoke. They have stain out of this world. And so that would be a time, if they were contraindicated for air polishing, this is a time where I would probably consider using a plus grit. Coarse grit, again, somebody with substantial stain buildup, again, due to smoking or excessive use of stain producing beverages. You then have medium. Medium is ideal for most of the procedures, especially for patients that desire a high level of polishing. Remember, you've just spent a whole hour using your ultrasonics or your hand instruments, and now all of a sudden they say, hey, when are you going to clean my teeth? And then, of course, you have your fine grit. You always want to make sure that you're using these for younger patients. But our younger patients are starting to present themselves with some adult staining based on habits, based on diets. And so, again, for that younger patient that requires minimal treatment, you definitely want to consider fine grit. For our patients who may be suffering from dental hypersensitivity, you do have your new Pro Extra Care. It contains Novomin in it, which has calcium and phosphate. And we know of the benefits of calcium and phosphate. That's actually what our teeth are made of. And so this helps to put those minerals back into the teeth. Again, this is free from dye, free from sodium lauryl sulfate, and it is gluten free. So this paste is excellent because it cleans, it polishes, and it desensitizes. So for those patients who may be sensitive, this is a situation where you actually may want to consider polishing first. Now, moving on to our power scaling technologies. What do I mean here? I am talking about the benefits of ultrasonics. I know at the height of COVID, CDC and other agencies did not want us using anything that produced an aerosol. Again, I'm just here to remind you that ultrasonics is considered standard of care, and with the appropriate aerosol mitigation techniques, you can safely use ultrasonics and keep yourself and your patients safe. What are the benefits of ultrasonic scaling? Of course, you get enhanced periodontal treatment outcomes. You have the improved patient experience if you know what you're doing, because if you're heavy-handed or you're using too much power or you're using the inappropriate tip, which we'll talk about shortly, your patient can have a very uncomfortable experience. Again, patient comfort if you know what you're doing, and of course, reduced operator fatigue. Sadly, most clinicians are underutilizing the maximum benefits of ultrasonics due to ineffective inserts. So you're using inserts way too long. If you have an ultrasonic tip that you've been using for 5 years, throw it away. Okay. They're using the inappropriate insert. So perhaps you're using a straight tip in a 7 millimeter pocket. And I have pictures to show you that you're actually not able to keep that tip adapted. You don't know it because you can't see it. There's incorrect adaptation, using ineffective strokes, and failure to navigate the anatomy. Everyone say hello to my beautiful baby Poppy. He is much bigger than this now. So there was a study conducted on the effects of instrumentation on in vitro periodontitis in biofilm. And to help sum this up, the study is not available yet, but this is the abstract of it. And to sum it up, this showed that when equal strokes are applied, the Cavitron 300 ultrascaling device removed on average 50% more active biofilm compared to hand scaling in this in vitro study. Okay, so the more active biofilm that remains, the faster the regrowth of the biofilm. So again, remember, we need to be focused on that biofilm, and we need to be using technologies that are going to be more effective with the removal of that biofilm. This study was not done to say that hand scaling is ineffective. That was not the point of the study. The point of the study was to demonstrate how much more effective ultrasonic technology can be when compared to hand scaling. Okay, and so this is just another slide. If you take a look at the Petri dishes here, ultrasonic, you can see that there was very little biofilm remaining versus when someone used hand instruments. Why does this matter? Again, I've already said during the hygiene appointment, we have very limited time. It's not like your patient comes in the door and you say, oh, hey, doctor, this patient needs 2 hours. So give me 2 hours. It doesn't work that way. Some of us have 40 minutes, 45 minutes, an hour. So we need to make sure that we're being the most efficient and effective with the time that we have. We know that there are 2 different technologies, piezoelectric and magnetostrictive. Each design has passionate advocates. They both do a great job of both calculus and biofilm removal. In fact, there was some independent research conducted, and it showed that both technologies scored high and scored low. So I often encourage practitioners to choose whatever scaling device that they are most effective and most comfortable with. With regards to ultrasonic technology, cleaning efficiency is what we really need to focus on. How do we achieve cleaning efficiency? We achieve it through modes of actions and mechanisms of action. So your modes of action would be the mechanical advantages, the benefits of irrigation, cavitation, and acoustic microstreaming. Your mechanisms of action are related to frequency, your power or your amplitude, and then the flow rate. So mechanism of action. Let's talk about the frequency or the vibration. So your frequency or vibration determines the number of back and forth strokes. So the number of times that the working end vibrates per second. So there are technology differences depending on whether or not you're using a piezoelectric or a magnetostrictive. With your piezoelectric, there's more of a back and forth stroke. So there are 2 active surfaces, whereas with your magnetostrictive, all surfaces are active, so you get more of an elliptical stroke. Why does this matter? Well, it matters because based on this, it will depend on, well, it dictates how you are able to adapt that tip to the surface that you're trying to debride. You also need to be mindful of different nodal points. And just quickly, this is just an example of the back and forth and the elliptical stroke between the magnetostrictive and the piezo. You also need to be mindful of nodal points. So what is a nodal point? A nodal point is an area along the tip where absolutely no vibration occurs whatsoever. And that typically can be found anywhere from 2.4 2.2 to 4.4 millimeters from the point of insert. So it may sound like a big number, but if you look at a ruler and you look at millimeters, that's not a lot of area to work with. And so this is really important because you have to be mindful of how you adapt the tip of that ultrasonic insert to the tooth. It's also important because if you're using a tip that is worn down, you're probably going to encroach upon a nodal point. So remember the nodal point, there's no vibration at all. And if you're on a nodal point, there's no vibration. Calculus specifically is not being removed. So naturally, the clinician is going to press down harder, making it uncomfortable for the patient. You could be removing tooth structure that you should not be removing, but it also dampens the vibration. So you're not going to be effective with your instrumentation. Your mechanism of action, so that another mechanism of action here is power or amplitude. And so this determines the stroke length. On low power, it's shorter strokes. On high power, okay, they're longer strokes. So I always like to use the analogy of punching. If I were to take my fist and go all the way back and hit the screen, I probably would crack it. I like to think I'm that strong, right? But if I were to take my fist and just slowly punch, there's not as much power or force behind it. So the higher you turn up the power, the longer those strokes are going to be working. And that's really effective when you are trying to remove those tenacious deposits. Now, if you have someone that presents with no deposit at all, they present in pristine health, they still have biofilm. So you should still be using your ultrasonics, but you don't need all of that power, right? So you definitely want to make sure that you're turning the power down low. We need to talk about insert wear. If you are using tips where the active area has been worn down, okay, you are not going to get the best efficiency from that tip. You get loss of efficiency. And in fact, what we find is that if you are using a worn tip, you're going to use 40% more force and it's going to increase your scaling time by 30%. So you need to make sure that you are always using tips that are not worn down, no matter whether you're using piezoelectric or magnetostrictive. It doesn't matter what unit you're using. Most manufacturers will have tip guides to help you assess whether or not your tip has worn down. This is just a quick quote. The superior efficacy and efficiency of ultrasonic scaling are a direct result of the technology of ultrasonics. The cleaning efficiency of a powered instrument is primarily determined by, again, the combination of the modes and mechanisms of action. Now, let's talk about the mechanisms of action. Flow rate, okay? So the flow rate impacts the amount of water that is flowing through the handpiece over the tip. You then have your modes of action, mechanical advantages, right? So the tip is doing the work for you. You then have irrigation. Again, that's the water. This helps to reduce healing time. It also minimizes the gingival trauma that can be associated with the use of ultrasonics. Another mode of action, the acoustic microstreaming. So as you can see, as shown in the picture here, you have these small circulatory motions of fluid around the tip. This microstreaming that's occurring can be really disruptive to any object that is near that oscillatory motion. So this actually has a disruptive effect on the surface of the bacteria. Next, you have your cavitation. How can I best explain cavitation? So what happens is that you have these bubbles. As you can see here in the little video, you have these bubbles that grow. And these bubbles are filled with a lot of energy. And what happens is that they have so much energy and eventually they implode. And when they implode, it's this blast of energy. And this also has a disruptive effect on the bacterial cell wall. So you don't always necessarily have to have the tip of the ultrasonic hit the bacteria, but you need to make sure that you're covering enough surface area so that biofilm in the area is feeling the disruptive effects from this acoustic microstreaming and the cavitation. Now, tip selection. This is extremely, extremely important. Your patients will drive selection. Each individual patient's presentation is different, okay? You've never seen the exact same deposit level on every single patient that you've seen. The anatomy is not always the same. Patient treatment is not a one size fit all thing. So you need to make sure that you have a variety of tips available to treat the various patient conditions that you may see on a daily basis. I'm just going to quickly go over some tips. This is one tip that I absolutely love. This is called an ultra thin or thin cert. Okay. This is really, really beneficial. Number one, according to the new AAP classification guidelines, you have these patients that present in pristine health. There's absolutely no hard deposit at all, but these patients still have biofilm. So you definitely want to make sure that the tissue is probably nice and tight, no more than a 3 or 4 millimeter pocket. It may be deeper for someone who may have a reduced periodontal as a result of ortho, or they've successfully gone through perio treatment. But you want to make sure that you have this thin tip. This tip can be as thin as your ODU 1112. This is really good for tight tissues, straight root anatomy, anybody that presents with a shallow sulcus, misalignments, or crowded teeth. Excellent for biofilm disruption and light deposit removal. There was a study conducted that compared the efficacy of this ultra thin tip to an 1112. Now, most times when we're scaling, hopefully you have an 1112 Explorer on your tray. What happens is that, we use an instrument, whether it be ultrasonic or hand instrument, and then we want to go back to assess whether or not we've removed that deposit. So then we have to put the instrument down, right? So we'll put the ultrasonic tip down or the instrument down, and then we'll pick up the 1112 Explorer. And believe it or not, we do that a few times throughout the appointment. This ultra thin ultrasonic insert is as thin as the 1112. So you actually can use it to assess whether or not you've removed that deposit. Benefits to that is that it saves you time. There are ergonomic benefits because you're not constantly twisting or reaching to pick up another instrument. There are also other variety of tips. A lot of people have the slim ultrasonic tips, so they can come straight or they come in a triple bend. You definitely want to utilize the triple bends. They are more effective in removing that tenacious or heavier deposits. Those triple bends in cross section mimic your scalars. So the bends along that tip are really, really effective in removing that deposit. One thing that I do want to back up and say is that for your thin cert, you want to use that on low power. That's what it's indicated for. For these slim ultrasonic tips, low to medium power. If you're using it on high power, then you're likely going to damage your tips. And you can see here on the screen under what conditions these tips would be useful for. This is just another picture of the triple bend here. Again, those bends are where you're going to have more concentrated areas of energy. I cannot advocate enough the need for everyone to have right or left tips or curved tips. This is especially important when you start to go into those deeper pockets, especially on those posterior teeth where the root anatomy will not allow for effective adaptation of a slim tip. And I can't tell you how many times people say to me, well, I know what I'm doing. I can use a slim tip and be just as effective. Well, how do you know? You don't know. A lot of times our patients are presenting with disease, or the disease won't resolve because of things that we do, but we don't want to take responsibility for that. So this is the picture. This picture shows you exactly why straight tips are not effective. You are not able to adapt that tooth on that curved anatomy for those posterior teeth. A lot of people are hesitant to use right and left tips because they can't figure out, is the right tip supposed to go here, or is the left tip supposed to go here? Well, never fear. Okay, so there are left and right insert guides that you can use to help guide you. Nobody says there's anything wrong with having little cheat sheets in the office. Have it up, have it on the counter somewhere, make sure it's laminated so you can wipe it down. But the beautiful thing about YouTube is that it also shows you how to use right and left tips. So you don't have to feel like you're fumbling around. There are guides to help you out there. You then have your standard ultrasonic tips. These are a little bit thicker. These should be primarily used for supragingival deposit removal. So if you're taking these tips and this is all you have and you're going subgingival and tight tissue, your patients are going to have a very uncomfortable experience, okay? So you want to make sure that you're using these appropriately. Typically, you want to make sure you're using this on a higher power. These standard ultrasonic tips also come in triple bend as well. It's important to know that we must select the proper insert to do the job. That's going to be important. Not all inserts are designed to handle all modes of power or applications, and knowing when to replace your inserts and doing so will actually help save you, the clinician, fatigue, and it saves the patient from having an uncomfortable appointment. So step out of your comfort zone, expand your clinical horizons, and go your own direction. Okay. Try something new. You may have, tried everything that I've talked about in today's webinar, and that's great. But you should always expand your clinical horizons. Consider using the slim curved ultrasonic tips. You definitely want to invest in a thin cert. Okay. Make sure you're having the appropriate conversations with your patients about controlling that biofilm, especially considering we know that biofilm is contributing to a lot of systemic conditions, okay? But take any pearl that you have learned today when you go back to work, whether it be tomorrow, next week, just make sure that you're implementing something new. So just to recap, we talked about the etiology of oral disease, specifically periodontal and caries diseases. We talked about the benefits of using a staged approach. So you want to make sure that you're removing the toughest deposit down to the finer deposits. We talked about the different protocols that assist with the removal of calculus, biofilm, and stain. We talked about the benefits of using ultrasonics, air polishing, and specific paste. We also talked about the need to use the appropriate tip depending on how your patient presents, the different power settings to use, the importance of making sure that you are replacing the tips as needed. And always, 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 you want to make sure that you're practicing ethical polishing practices. I want to thank you for spending time with me today. If you have any questions, definitely reach out to me, info@drjoyrdh.com, on social media @drjoyrdh. If you are interested in trying any one of the tips that I presented to you today, definitely reach out to your local Henry Schein rep. They can be a great resource for you. If you need additional information, definitely visit the Dentsply Sirona website. But I want to thank you so much for spending time with me today. If you have any questions, definitely feel free to type them in the chat. If you have additional questions beyond that, you want to make sure that you reach out. You can send an email to webinars@henryschein.com. Once again, thank you.
Thank you, Dr. Joy, for your time and expertise this evening. And thank you to Dentsply Sirona for sponsoring this webinar. We did record tonight's webinar and we'll email the recording out sometime in the next week. We would appreciate your feedback via our survey that will pop up on your screen shortly. Thank you all for joining us, and we look forward to seeing you on future webinars. Have a good night.